Hi guys, welcome back to my YouTube channel. I am Kabelo Hlupo. I am a pharmacist, and today's video is gonna be a very simple one where I'm just trying to calm your nerves if you have your cervical screening appointment booked, or if you've never done the test. I'm here to tell you there's nothing to worry about. I'm gonna be telling you what actually happens in those screening rooms and why you need to book your appointment today if you haven't already. Or if you have had your tests done but you didn't ask questions, I'll be answering some of those questions in today's video. So let's get started. So I like to keep it lighthearted. So obviously I'm going to be starting with the very lighthearted points, which are precautions. You can't go if you are on your period. Do not have sex the day before, and you can take someone if you are uncomfortable, you don't want to go alone. I think it's okay to bring someone. Almost everyone will say expect some pressure. I say expect discomfort and pain. Well, I have a low tolerance for pain. Like if you're a member of this family, I don't do pain well. So maybe it was not but no, it's uncomfortable. So that's everything you need to know before you go in. Oh, but the one thing that's almost always on people's mind also is, do I need to shave? It doesn't matter. I'm sure they've seen it all. So relax, do what you can, do the important things, which are 1 and 2, and then everything else will be taken care of. So once you're in the room, you are obviously free to ask questions. Make sure you are comfortable to actually get up on that table. Don't just go because now you've booked an appointment and you're there. If you're uncomfortable, you can leave, because it's a very invasive test. I mean, you really, your comfort is absolutely important. So what happens is, you get naked from the waist down, you lie on your back, you open your legs, and then you bend your knees. So I'll insert a picture. Yeah, but you get in that position, and then they insert a device called a speculum. In some settings, or with some people, they can actually use a water-based lubricant to make it a little more comfortable for you. But I'm not sure if it's because I didn't ask, but yeah, there was no niceness of making things easy. It was a metal speculum, and it went in. But in researching about how these things are done, I learned that there are different sizes of speculums, and some are metal, some are plastic. So again, in the conversation you have before you actually get on the table, you can ask and find out if they can use devices you feel you'd be more comfortable with, and how they can make the process easier or as pain-free as possible for you. I didn't know. I just thought there was that one speculum and that was that. So anyway, the reason you need to get this test done every 2 to 3 years is because, I mean, cervical cancer is common and it's very serious. It's a very serious problem. This way, in doing this test every 2 to 3 years, you can catch it in time, because what they actually do is, in inserting the speculum, they open to see the mouth of the vagina or the uterus, that opening, the cervix, and there's cells there that they swab. And the reason I have this in my hand is because this is actually the brush they're supposed to use looks something like a spoolie. That's why I had it with me. But anyway, yeah, they insert the brush to collect the samples at the cervix, and then they take those, or the sample, or those cells, to the lab. And what they test for is if there's any abnormalities in the cells of your cervix, or if there's any changes that may have been caused by HPV. And HPV is human papilloma virus, which is what actually causes cervical cancer. So essentially, you do the cervical screening to test for cervical cancer. And the reason you're supposed to do it regularly, and yeah, 2 to 3 years is regularly, is because cervical cancer, before it actually gets to being cancer, it develops over time. Those cells, they will start changing. Those cells, sometimes they look abnormal, and it's a process. Like, it happens over a period of time, and for some people it may take up to 10 years for the cells to start changing and looking abnormal to the point where they actually have fully become cervical cancer. So that's why you're supposed to actually do it, especially if you are sexually active. If you are to take anything away from this video, is that you need to really, it's a very serious test and you need it. But in Lesotho, I remember from what the lady told me, she said they actually take your specimen to the lab if you are over 25, and I don't remember the rationale. I don't, or maybe it's the average. No, I don't want to guess. I don't remember why she said that, but yeah, in Lesotho, they only take your sample to Sangatana if you are above 25. Otherwise, they look, yep, bare eyes. She looks at your cervix and decides. I think she said if it doesn't have any white patches, then there's no abnormalities. But yeah, her naked eye, she looked and said, good to go. So maybe if you have certain symptoms already and you really need a proper thorough lab-based screening, you can go to a private doctor and talk to them and ask that you get this test done. I am editing this video, and I decided I needed to make a note here because I thought it was weird that the lady kind of had a peek around and didn't biopsy anything or send anything to the lab. But the reason, I came across an article that explains why that is the standard practice all across the world, and even the US, where they always started testing people at 21, have amended that guideline to start testing people at 25. And the reason, simply put, is that before the ages of 25, according to that particular article, is that there's hardly any conclusive results from the tests, or even if there's abnormalities that may later turn to cervical cancer, less than 2% of them are ever detected in anyone younger than 25. So they decided, why not just test only in people who are over 25. So, but anyway, the reason I brought the if you're sexually active or if you're not sexually active, when do you know you need to test? HPV is sexually transmitted, and so if you are having sex, automatically you are at risk, especially unprotected sex. So 98% of all cervical cancers are caused by HPV. So I mean, that's a scary number. But some doctors or some gynecologists say people who are not sexually active do not even need to get this test because, like I've already said, the 98% is sexually transmitted, and the 2% that is not sexually transmitted cannot be detected by means of a cervical screen or a pap smear. So it's kind of pointless, but that's one argument. There's people who argue that everyone who's of reproductive age should get a pap smear, or at the very least a pelvic exam. And a pelvic exam is more holistic. They don't just screen for cancers, they test for STIs, they test for a lot of other things that have nothing to do with just sexually transmitted infections or cancers. So children from the ages of 13, I believe in some countries, actually get pelvic exams. But my worry is that speculum thing with a 13-year-old. I'll do a separate video on HPV because in speaking about it and I keep saying HPV, I realize I might need to explain thoroughly what it is and the causes and the symptoms and such. Comment if you have any questions, or if you want to talk about things that may be more private and you're not comfortable sharing in the comment section of this video. My DMs are open across all of my social media platforms, so I can connect you with the gynecologist, or if I can help you, I'll answer your questions or point you in the direction of someone who can help you. So see you in my next video.